मुझे लगा कि पता नहीं कि वो आएगा कोई बात नहीं। तो ये बताओ, हाँ हाँ राइडर दे देंगे क्या? मेरी बेटी का ट्यूशन भी है। हाँ हाँ अच्छा जी, पहुंचा देना 2 प्लेट है ना, नान और चिली पनीर, और दूसरा क्या बोले थी? हाँ, और पैसे बता देना, राइडर के पैसे भी होंगे।
I believe Dr. Neeraj has also logged in.
मैंने नहीं समझा, सोचकर मम्मी ने पूछा था।
Yes, he's there.
Good evening, Dr. Neeraj.
Good evening.
This is Nikhilesh from Hindu Council.
Hello Nikhilesh bhai, how are you?
Good, good. Kamal ji, आप अगर हैं तो you can make Dr. Neeraj as a co-host as well, because he may be presenting. Like to share the slides?
Certainly, yes. Just give me a minute.
Play him is required.
Yeah. Hello, Dr. Neeraj.
Hello, how are you?
Yes, very good. This is in the name of Neeraj Vasavada.
Correct.
Okay. Good.
So are you still in the hospital or what?
Oh yeah, no, I just finished one surgery, so I just was rushing for the meet. There was some emergency, so I had to handle it. The background is not so good, so I kept the virtual background.
Good to see doctor relaxing somewhere in the evening at this time.
Yeah, no, but unfortunately, I came a spine trauma and had to operate. I was a little worried that I might get delayed, but fortunately, have a good team. So, I think we are finishing off.
Good.
We are through the major part of the surgery.
That's good. Thank you very much. My name is Nikhilesh. I handle the Health and Environment Directorate of this Hindu Council of Kenya. I have with us our National Chairman, Mr. Kamal Gupta ji, and our Executive Director, Mr. Ravi Kaul. So they are here. Although we are given time, of 7:30, but you see now there's a lot of festivals are going on. So even our chairman has to. He's, I believe, very near to this Navnath, because there is a Garba today, so he has to go there to participate.
Oh, I think he's in the parking somewhere.
I believe yes.
Garba today on Karwa Chauth.
Hey guys, tomorrow.
It's tomorrow actually.
Yeah, every day कुछ ना कुछ होता है.
I know. I'd been to Kenya. Nairobi, there is always a party at night.
Yeah. No, actually, today was a very hectic day for Hindu Council. We had a vaccination program in the morning from 10 to 2 o'clock. Then we had our some RSS and HSS. This Deepavali, this was there. So then this one. So quite this thing.
Great.
Kamal Bhai Sahab, Beena is executive administrator for Shalby Hospital in Kenya. She handles here.
म्यूट कॉरिडोर एक टच स्क्रीन पर स्क्रीन पर दबाएं और म्यूट का बटन के नीचे
Tejas will be joining us today.
I told him, but I don't know if he'll be able to make it.
Jignesh Bhai, good evening. Thank you very much.
How are you? I'm doing multitasking. There is a Garba in Navnath today.
Yeah, I know. Kamal Bhai is also on the way, just reaching.
Yeah. Multitasking. No worry. But the subject is of my interest, so I have to attend.
Great. So Ravi Bhai Sahab, aap advise kariega when to start, because it is already 7:30 and it must be 10 o'clock in India. So Dr. Neeraj must be, it'll be it's a 1 hour, mean almost 11 o'clock it will be. So what time you suggest we can start that?
So I just, can I take a minute? I just I have kept a talk about 20-25 minutes. Do we have a question answer session, or how would you want to go about?
Maybe we can have for some five question answers at least.
Okay.
Because of the time.
Okay.
And maybe if somebody has more questions, they can put it on the chat
Yeah.
and we can reply them later on.
All right.
So maybe 3 more minutes, Niklesh, then you can start.
Yeah, as you suggest.
I can see Dr. Patel is also there.
Mhm.
Moreover, as I mentioned that we are already live on YouTube as well as our Facebook.
Facebook, yes.
So I hope that the followers are more than 25 to 30,000. So maybe we can see people are getting benefited on different other platforms. So in that way, it will be also meaningful that to be very, very open. And as your question, Dr. Neeraj, is primarily whether Q&A, I wish that we take that session
Sure.
and is going to coordinate to ensure that people get full understanding and full advantage of this session.
Lovely.
So by the time we are going to start, Dr. Neeraj, you said you have visited Kenya earlier and you have been in Nairobi. So
Oh yeah, I had been. I have few friends there. So I had seen your Hindu Council also. I have few friends who some are doctors who actually left Kenya now. There are some who have joined there, but I have a lot of family friends also there.
wow.
You can name one or two.
I don't know whether you know Prashant Ruparel.
Ruparel, yes, Ruparel family, yeah.
Sir Prasad Ruparel, then that I mean I forgot then one of my dear friend, he is a restaurant. He owns one of the restaurant there in your Diamond
Andy?
Plaza. Vicky
Chopati?
Chopati, yes, Chopati.
Mhm.
So that then one of my school friend Chola Ganatra is staying there. So there is one Dr. Harish Rupani, ENT surgeon
Yes.
there in.
Yes.
Nairobi Hospital.
Yes,
Yes.
he is into I think Jalaram Trust or something.
Jalaram Trust, yes.
Yes.
Jalaram
So,
Hospital.
I think, yes. So there are few friends, I mean, I haven't visited them since very long.
So you have
Dr.
been to Diamond Plaza.
Oh yeah, I have been to.
No,
I
he
have,
said even he knows Hindu Council. So it means he has
Yeah,
seen
yeah.
that Pussy Lane.
That
Correct,
area,
correct.
yes.
I stayed, if I'm not wrong, that India Club or the club just beside the stadium,
Gymkhana.
cricket stadium. Gymkhana,
Gymkhana.
yes. Yes, I stayed there for 3 days. That was, I think, in 2015 or something.
Good. So
Okay, Niklesh.
can we
Niklesh, I
start,
think-
sir? Although the numbers on the this one is not much, but as Kamalji just mentioned that, and but considering the fact of the festival time, people will be accessing through their Facebook and YouTube, and we can start that. Can we start, sir?
Yeah,
please.
sure. Should I share my screen?
Yeah, so let me just, for the benefit of everybody, officially welcome Dr. Neeraj from Ahmedabad, Shelby Hospital, who is consultant and head of department of invasive and endoscopic surgery. Before we go to Dr. Neeraj, I want to say thanks to Ms. Beena Samani, who is executive administrator of Shelby Hospital in Kenya, she has also worked with the Royal Hampstead Hospital in UK some time back. And now she is stationed in Nairobi. She handles the operation of this. Before I come to you, sir, I request our national chairman, Mr. Kamal Bhai, to address for a few minutes, because then I believe he has to leave. So it will be better, then we will continue there with that. So over to you, Kamalji.
Yeah, thank you so very much, Niklesh bhai. In fact, really appreciate your efforts to bring such a learned person on this call, none other than Dr. Neeraj Vesavada. And we are very thankful, Dr. Neeraj, for your time and for your valuable presentation, which is going to be very meaningful for our community at large. And that is how we are taking our efforts as an Hindu Council of Kenya. Our executive director, Ravi, is also putting a lot of positive efforts to ensure that we bring
ભલે કશું કરો નહીં પણ ઓનલાઈન થઈ જશે.
Nilesh, you're here.
So the idea is to actually serve to the community, serve to the people. Those are expecting something extraordinary for them as a service to the people, and that is what as a team of Hindu Council of Kenya is continue in our endeavor in terms of bringing values, and that is how the efforts were being made by our Executive Director Ravi Kaulji and Director Niklesh ji to bring this subject, which is a very meaningful subject, in the interest of the people. And we are thankful to Bina from Shalvi Nairobi. Really appreciate your coordination and compilation to bring everyone together and ensure that we can make this session more interesting and more meaningful, because we understand that this is the topic where people would love to learn, as I understand from Jignesh also, that this is a very interesting and important subject. And at the same time, the kind of services, the kind of inputs which you are going to bring in during all these time, while you're maybe even during Q&A, that would be also very interesting to let people understand what the questions, what the queries they do have, because that will make them confident that yes, that they understood the subject well. Yes, Health and Environment Directorate is committed to take care on the health aspect and maybe bringing a lot of educational values, and environment side of the directorate is always committed to do environmental activities, whether it is recycling, whether it is tree plantation. To definitely heads off to the directorate, which is doing wonderful job. Hindu Council of Kenya is an umbrella body, just to let people know and understand that this is a national body recognized by government. Across the country, we have 5 branches, and each branch is committed to take care the need of the people, those are staying around that area. And we are a unified voice as a Hindu Council of Kenya to make a lot of inputs for the respective agencies. Like we are recognized in government and coordinating with various embassies, various countries, to ensure that we will really get those inputs and value for our community at large. During this tough time of COVID, Hindu Council of Kenya played a very significant role in the form of assuring that people around us, indigenous people or those who are underprivileged, those they need support and any kind of assistance. We as a Hindu Council of Kenya team really worked hard to brought all those inputs for them. This is very important because that is our values, and that is the maybe a culture what we always proud of as a community. And second is that we will always be responsible and taking care of the aspects of our own community in best possibility. That's how the efforts of today's call and today's webinar is primarily to ensure that those who are having any valuable inputs or any point which they want to learn out of this call would be really going to serve that. Again, thank you so very much for your valuable time, and we look forward that collaboration will go far, and we will be benefited as a community with your knowledge as well as your generosity. So once again, thank you very much for being on this time, and then your input are going to make people very comfortable. With this note, once again, thank you very much, each one of you from the directorate side, and look forward that community is going to benefit with this talk. Let's make this talk as interactive as possible, and we will see that people would get advantage of overall session. Thank you. Thank you very much, Dr. Neeraj.
Thank you so much. So should I share my screen now?
Yes, please. You can share your screen, your co-host also,
Okay.
and please proceed.
Okay. At the outset, let me thank Hindu Council and entire members and executive body of Hindu Council for giving Shalvi an opportunity to bring awareness among the community. I would want to thank Tejas Bhai, and I think we just joined, and Ms. Beena for coordinating such a wonderful webinar across the border. So probably this is a blessing in disguise. Pre-COVID, probably nobody thought that this kind of webinars, cross-border talks would be possible. So yes, we can take out. It's all about attitude that we take it positively. That COVID brings us something positive, although a lot of negative, but there is something positive, and life goes on if we only look at the positives, avoiding the negatives. With that theme in mind, today's my topic is digital spine OR and safe spine surgery protocol. Now, why I chose this topic, being a surgeon, everybody would want to know that, okay, this guy is going to talk about surgery again. It's a digital OR. I'm talking about surgery. So the reason why I chose about digital spine OR or a safe spine surgery protocol is, one question I always ask every audience whenever I am giving or delivering a talk is, will you get spine surgery done as easily as you may get knee replacement surgery or any other surgery? And 90% of the time I receive a reply that no, that is not possible. Spine surgery, I cannot think of. There are a lot of myths prevailing about spine surgery, starting from it requires a very prolonged recovery time. Majority of the patient cannot get back to their normal life. Patients keep on suffering from pains, disabilities, and the biggest fear is I will not be able to get up again and I will be bedridden. So a lot of myths are prevailing about spine surgery and spine diseases. So today it's my humble attempt to bring forth what is the development has occurred in last 20-25 years in spine surgery and how we do spine surgery, and really whether spine surgery has become safer. If need be, should you go for spine surgery or not? That is a small topic I have tried to cover in this my topic. Now, why there is a reluctance of spine surgery? Before I try to bust a myth that spine surgery should not be done, we need to go back and try to think about that why these kind of myths, wrong impressions are prevailing about spine surgery. Why there is a reluctance that spine surgery should not be done? So first and foremost, spine surgery has a very late scientific surgical development. If you go back 50 years, I think majority of scientific endeavor, scientific research, scientific efforts were mainly focused on life-saving surgeries like cardiac surgeries, brain surgeries, cancer surgeries, and lifestyle surgeries have taken a back seat. Because lifestyle surgeries, which is spine surgery is one of them, are not hampering or endangering your life, your livelihood. It only makes your life disabled. So because of that, the focus was not adequate in past, and spine surgery could not develop 50 or 40 years back and started getting bad name. Even today, 80% of spine surgery spine problems doesn't need surgery. Why this topic is important, that a surgery where 80% of the patient gets all right without surgery, naturally scientific resources would be allocated, will be much lesser than other surgeries where the majority of the patient would require a surgical intervention. So spinal surgery has to take a backseat, and there was a surgical apathy for that a surgery where majority of the patient gets all right without surgery should not be focused upon. All that's led to a kind of, you can say that avoidance of surgery in surgical community. If you go in past, there were insufficient diagnostic modalities. I remember when I was studying my MBBS, that was way back in 1994-93. We, in our hospital, which is a major government hospital, it is a 1,000-bedded hospital, and we did not had MRI in those days. So diagnostic facilities was not available in every nooks and corner of the countries and in the world. MRIs were mainly considered luxury of developed countries, and India, Africa, or developing countries, this kind of facilities were not there. So when you don't have a diagnostic modalities, naturally diagnosis will be not accurate, and which will lead to wrong selection of surgeries, wrong selection of treatment protocols, and patient would keep on suffering. So lack of knowledge about spine and its pathologies and treatment gave a bad name to spine surgery per se. So what has changed now? Why we started doing spine surgeries, or why we started advocating spine surgery? I would say it is the youngest offspring of orthopedics or a neurosurgery. what we know today is still a tip of an iceberg. That means a lot of things we still don't understand about spine surgery, but the tip of iceberg is ever expanding and ever getting taller and taller, and we know much more than what we used to know 20 years back. If you look back 10-20 years back, spine surgery was being performed as a part-time surgery by orthopedic surgeon or a neurosurgeons, where orthopedic surgeons were majorly focusing on joint replacement surgeries, trauma surgeries, and they were neglecting spine surgeries. Similarly, neurosurgeons were mainly focusing on brain tumors, brain accidents, craniotomies, and all those stuff. And spine surgeries were neglected by them also. So from being a part-time expertise of ortho or neurosurgeon, it has become now a highly specialized branch of expert, which may be an orthopedic surgeon or a neurosurgeon who are dedicatedly doing exclusive spine surgery work. From a doomed specialty, it has become a result-oriented, targeted surgical branch. What we have learned from our experience of almost 20 years into spine surgery, at Shalby, we have introduced a safe spine surgery protocol, which gives desired results to our patient. Now, what is this safe spine surgery protocol? First and foremost is pinpoint diagnosis. Without proper diagnosis, any treatment what you are doing is not going to yield a desired result. So pinpoint diagnosis is very important. We take a lot of efforts and time to identify the pathology, identify the problem, and accordingly we decide and tailor a treatment so that we can deliver a good result to our patient. Spine surgery or any major surgery is requiring a surgical team. Single surgeon, single mind cannot give the best result. A single person, Virat Kohli cannot win World Cup. Virat Kohli would also need a dedicated and very successful team to win a World Cup. So we employ a surgical team approach. We only operate with MIS technique. MISS is minimal invasive spine surgery technique, where we try to preserve normal structure of the spine. We try not to damage muscles. The blood loss is significantly less. You can say majority of the surgery, the blood loss is 10 ml to 20 ml only. Patient walks in within 3 to 4 hours. There is very, very tiny cuts on the incision without opening much. And that has started improving our results in surgery. Along with surgical technique or surgeon's expertise, technology has developed so much that we have introduced breakthrough technologies which are available or which are private to any Western countries, that is available inside our hospital, and we call it a digital spine OR. In a short while, we'll take you through what is our digital spine OR. But digital spine OR is an operation room which is equipped and studded with a lot of technologies available to make a surgery safe. We follow a very aggressive rehabilitation. Spine surgery in past required 3 to 4 months of bed rest, almost 6 to 8 months, 9 months of time before a patient can get back to normal activities. Now, with our safe spine surgery protocol, our patients are walking 3 to 4 hours after surgery. Majority of them, they start climbing stairs, walking around the corridor, doing their daily activities on second day of spine surgery. Majority of the patient within 1 week can get back to their normal productive lifestyle, normal professional lifestyle. Post-discharge care is very important. If you don't focus on a patient about strengthening muscle, preventive aspect of spine surgery, then your patient would not yield a lasting result. So along with surgical intervention, post-discharge care is also equally important, and we take utmost care and a lot of pain to follow up with our patient so that they can get an optimal result. Now, what is a digital spine OR? This is an actual picture of our operation room, and you can see there are a lot of gadgets and equipments which are available to make a spine surgery safer. So digital spine OR, first and foremost, I will introduce each and every technology in a while, but just to enumerate them, digital spine OR requires a tubular retractor system, a high definition C-arm, Pentero 900 OPMI Zeiss microscope, surgical endoscopes, intraoperative neuromonitoring, and very recently we have introduced a surgical spine navigation or a computer assisted surgery. Now, what are this tubular retractor system? The tubular retractor system is an instrument set which creates a space between the muscle, so we don't have to cut the muscle. We just open a small space between the muscle fiber, reach to the spine, and perform a surgery better. Something similar to this, you can see that this is a tube from which a small 1-inch hole is made on the spine surgery. This is the nerve which is visible, and we can decompress. In previous time, in old time, it would have required 5 to 6 inches incision, but with advent of this tubular technology, now less than 1 inch incision and we can perform this surgeries in our patient. Just a small video of how we do it. You can see that this is just a 1 inch cut which is there, and we are opening a muscle with gradual dilation of the muscle, creating space one by after another. This retractor system is attached on a table with a robotic arm which keeps the retractor or a tubular system in place, so that through which that opening we can operate upon the spine. So you can see this, this retractor is attached with this robotic arm, and a small, nice 1 inch opening is created on spine. Now, the beauty of this thing is, this would not require any blood loss. This will not damage any muscle. The muscles are normal, the bones are normal, no blood loss, and surgery becomes a very physiological surgery. We have a very high definition C-arm. This C-arm can imagine spine in a heaviest of the heavy patient, and almost can work and show bone in any kind of a surrounding where sometimes lower frequency C-arm and obesity of obese patient, or a patient with lot of degenerative or age related changes may not be able to give us a proper imaging while operating. This high definition C-arm would give us a very clear cut view of the spine. We have a probably finest surgical microscope available in the country, and this is only a single installation in entire Gujarat. And you can see that what this microscope can do to our patient. You can see this video. This is primary picture is with naked eye. You can see this is a tube which is visible. This is the muscle. Now I will start zooming under microscope, and you can see how much magnification this microscope can give with absolute clarity. You will be able to see each and every muscle fiber with this microscope. You can see this muscle fiber. Now this is almost 15 to 20 times of magnification with illumination. So that makes the magnification makes spine surgery much safer. You can see this is a spinal nerve which is visible under microscope, which is thin like hair, the hairs of the head. This is almost 20 to 25 times magnified view of spinal nerve. Now, when you're operating, just think about, you can very easily damage a hair-like structure, but you can never damage a rod-like structure or a rope-like structure visible under microscope. So microscope helps us to make spine surgery much more safer than it was. We use spinal endoscope. Now, the beauty of this endoscopic surgery is in geriatric patients, in patients who are old, medically fragile, we can operate these surgeries with endoscope under local anesthesia. Patient can absolutely walk out of operation theater as there is no anesthesia which has been given, and patient can get admitted in hospital in morning and can go home same day evening without the previous pain for which patient was admitted. The greatest fear of spine surgery is, what if I undergo a surgery and I wake up paraplegic? Now we have an equipment, we call it an intraoperative neuromonitoring. The beauty of this equipment is it gives a real-time feedback about nerve function when we are operating upon a spine. So God forbid, while operating, if I am damaging a nerve, before the permanent damage happens, this machine sounds an alert and I can take a step back, or I can change my territory to operate and can save spinal cord or nerve. So with this introduction of this intraoperative neuromonitoring, the neurodeficit, paralysis, nerve damage has reduced very significantly in our setup. Now the beauty comes is navigation or a computer assisted surgery. If I come to Nairobi, I don't know the roads and where to go. I just put up my destination on a Google map, and Google map would show me the way, and I can reach my destination without asking my destination or a route to anybody. Navigation does exactly the same. It gives us a three-dimensional orientation of a spine. It projects on the screen, and every instrument which I am putting into spine is demonstrated, or it is shown on the image. So I perfectly know with a precision of almost 96% where my instruments are, whether I am going in a right way, whether I am putting my instrument screws and everything in appropriately scientific way, or I am trying to damage any structure. This navigation helps me intraoperatively real time about my position of my instrument. So this is a GPS for spine surgery. This has probably revolutionized spine surgery across the world because it gives us a 3D vision, which a naked eye only can see a 2D vision. This is my surgical team, which makes my spine surgery much safer than what it was. So we are 3 surgeons operating into spine. I am fortunate enough to lead the team. I have another surgeon, Dr. Pratik, who is with me since last 7-8 years with an experience of more than 1,500 spine surgeries. And we have another doctor who recently joined as a trainee, and hopefully he would continue with us. So with this safe spine surgery protocol, we have been successful in treating very, very complex cases. You can see this kind of deformities also is possible to be operated upon without much damage to the patient with this technology. This is just a small video of, our digital spine OR initiative that will just take you around actual operation room, what Shalby is having. I hope you hope.
There's no voice actually. Can't hear. Dr. Neeraj, we can't hear anything.
Oh, you're not able to hear?
Nothing.
You're not.
Your voice is
able
clear, but the video, there is no sound.
Yeah, video is okay, but no sound.
Okay, I'm not sure how to, because I can hear the sound, but I don't know how can I make it sound to you. But anyway, this is just all about what I spoke. So there is nothing new here. This is just, the images which I am doing, actually I'm operating on the spine. So we'll not take much of the time here, and we can probably go for the next. So this is what our spine surgery has changed in last 20 years. The greatest myths which are prevailing about spine, that patient cannot walk after surgery, there is a delayed in recovery, spine surgeons are never successful. All these myths have been busted with recent advances in experience and technology. Our patients are almost back to their normal life within 8 to 10 days time. Majority of the patient forgets about the surgery by the end of 3 months. We have been fortunate to operate a lot of patients from African countries across the country, and I think we will keep on doing so. So I probably open this session for the question answer, because just a small video, I don't want to take much of your time. It's a weekend for all of you. So any questions, anything, I'm open to reply to them.
Dr. Neeraj, thank you for this presentation.
Yes.
Okay, my name is Jignesh. I'm part of the Hindu Council committee.
Hello, Jignesh bhai.
Yeah, hi. I go through degenerated disc disease for probably last 14-15 years. And yeah, as the time passes, it just keeps getting worse. So there is a lot of time when we have discussed about whether we should get the surgery done or we should not do. Whichever doctor, the spine specialist, I have seen them in Kenya, they have always said no need of surgery, probably physiotherapy and strengthening the muscles, whatever, yoga stuff, which I have been doing. And along with that, I also have a neck issue. So my question would be, is degenerated disc disease curable first? Second, is it curable only by way of a surgery? And in case if we have to pursue or, to get in touch with you, would you be able to share your contacts by which I can share my MRI reports on email or something, and then take it from there?
Okay, so I'll reply to your third question first. Yes, and I think Miss Beena can help you about getting both of us connected. She will have my mobile number. She will have my email address, everything. Now
Okay.
let us come to your first question. Whether the degenerative disc disease is curable. Now the answer is hidden into name itself. It's a degenerative disc disease. Degenerative per se means aging. Nobody can cure aging. So, if you say that degenerative disc disease cannot be cured by any means, we can try to treat it, but we cannot cure it. Because if I can reverse your aging, your age, I don't mean to say chronological age of your since your birth. Aging is body which has undergone wear and tear. That is what we call aging. So don't confuse it with age. Because your DP looks, you are quite young. You are not aged at all. So I would not want to dare to say that you. I would not want to dare to say that you are aging.
No, don't go by
So-
that. I'm 55 now.
So stay. You look 35. So anyway,
Yeah.
I guess the answer is we do treat degenerative disc disease, but majority of these problems are wear and tear of the disc. We have abused our body. We have used our body. We have tried to walk on bipedal gait. The human race evolved from monkeys. We were walking four-footed, and now we started getting an erect spine. We started walking on 2 feet. So we are paying to be a bipedal gait is degenerative disc disease. Entire load comes on your lower lumbar disc, and that starts showing signs of wear and tear. And sometimes in some person that starts giving you a lot of pain, disabilities. So it cannot be cured. One. Second question is majority of the patient, as I said, 80 to 85% of the patient, they feel all right with regular physiotherapy, proper exercise. Sometimes, they have to take some injections around the joints and inside the disc. There are some modalities, that can help to this patient. Very rarely, I would say, 5 to 8% of the patient, yes, surgery is required. Very recently, in fact, one of the patients came from Tanzania with, similar problem. He had been refused surgery by everybody. We evaluated, we did all the tests, and we advised him for the surgery. Unfortunately, we could give the result, but he was one of the kind patient. Majority of degenerative disc disease requires only a long-term physiotherapy. But if it is not helping, yes, sometimes surgery does give result to this kind of patients.
Thank you, doctor.
Thank you.
Nikhilesh.
So
I believe, doctor, there is a question from Dilip and Shobi Shah in the chat box. If you can just have a look of it.
Okay, yes, okay. The disc 4 and 5 have problem. What can be done? See, first and foremost, it's very misnomer. Most of the time, patient asks me that I have a problem in disc 4 and 5. First thing we all need to understand that nobody's MRI will be normal. Those who are attending this webinar and those who are not, if we get randomly MRI for each and everybody would show sign of wear and tear. So no MRI is perfectly normal, because perfect normal MRI is possible only in newborn. The moment you start passing your day after taking your birth, the spine will show changes of wear and tear. So just having a problem in 4 and 5 described by X-ray, MRI does not mean that your spine is wrong. So it is always the symptoms which decide the treatment. Whether you are disabled, whether your back pain is not allowing you to do your daily work, whether this back pain is preventing you from walking long, whether the back pain or a leg pain or a sciatica is bothering you so much so that you are not able to perform your activities of daily living, like going to office, doing your household work, enjoying your life, all those stuff. If this kind of problem, the disc problem is causing you this kind of trouble, then you need aggressive treatment for patients.
Yeah, carry on, please, sir.
Yeah, so that was just having a problem at 4-5 doesn't mean that your disc is bad or you have encountered a serious problem, serious disease. So if your problem is not significant, then you don't need to do anything. Majority of 4-5 disc, that is the disc which is most of the time degenerated, because that disc moves the most. So for everybody would have, majority of patient would have 4-5 disc problem and only requires good physiotherapy.
Dilip ji, bhai, hopefully he has been able to answer your query, or you want to ask something, you can unmute yourself and ask question.
Thank you very much, doctor.
Thank you, Dilip bhai.
Yeah, I have understood very well, because I have not that serious issue problem, but
Yes.
I was last year I was in Ahmedabad, and
Yeah.
I climbed Palitana mountain, and when I came down, I had a
Okay.
very serious problem, and I
Yeah.
then it seems I took out this MRI and everything, and
Yeah,
it was showing the problem, but since then is
Okay.
already now 18 months or no. So
Yeah.
I'm regularly doing some exercise, and I'm doing my playing golf, doing all the other
Absolutely.
activities. So there is no actual issue, but I was worried because of sciatica also. I got some sciatica problem.
See, I'll tell you, when you climbed Palitana, you did a kind of an activity which you are not doing daily. So your body is not tuned to take the load which you probably gave on for that particular day when you climbed Mount Palitana. So it was probably nothing but muscle fatigue. Most of the time, acute back pain happens when any unaccustomed activity is being performed. Say like heavy weightlifting, you climb mountains. Somebody runs a lot. Somebody walks a lot. At that time, your disc shows acute damage. Now try to understand or try to imagine your disc, L45 disc, as a rubber tire of your vehicle or a car. So outer portion of the disc is a tough rubber, and inside the core is a soft rubber tube. Now with extra loading or unaccustomed activity, the outer portion of tough rubber fibers, they get punctured or just get torn. When they get torn, body produces an inflammatory response to heal that part, and that inflammation sometimes irritates the nerve, and that gives an acute problem. Majority of this pain, even if you don't consult any doctors, they get all right within 10 to 15 days time. So I would say that you don't probably have a 4-5 problem, and you can rest at peace. Just keep on doing your exercise, what you are doing, and please live your normal life.
Hey, thank you very much, doctor.
Thank you.
This problem, I believe, Dr. Neeraj, is a very common what do you call understanding of the layman. That
Yes.
when we talk about back pain, because of the Google invent of Google and internet, if I get up from my bed and I feel like having some back pain, I still immediately start Googling whether it is this 1, 2, 3, 4, 5 or whatnot.
Yeah. True.
So I believe
No,
that is also what exactly is the situation you suggest that somebody should really need to consult a doctor if he feels like going for MRI is not an easy thing and cheap thing in Kenya or otherwise also.
No, in fact, I tell you, world over, it has been proven beyond doubt that for acute back pain, even for acute sciatica, very rarely you require MRI at first go. MRI or any other aggressive treatment is required only if your pain is persisting more than 15 days to 3 weeks time. Then you need to go and just check that nothing wrong is happening. Believe me, science is very clear. Majority of disc herniations, slip disc, they get all right within 6 to 8 weeks time. Even if you don't take any treatment, or even if you don't meet doctors like me, you are going to be fine 80% of the time. Those 20% only requires people like us to guide them that what should you do. Now, the commonest question which you ask is what to do if you have a back pain, and when to consult a doctor. So if you have a back pain, there are a few things you should start doing. One, for maybe 1 or 2 days, do a good rest. Mark my word, I'm not saying complete bed rest. I'm saying good rest. Good rest meaning, take a break from your routine. Don't do activities those are aggravating your pain. Take rest intermittently. Don't probably try to exert too much on your body. And we call it as, in medical term, we call it as relative rest. So slow down from your activity. Reduce your work, day-to-day work, by 60 to 70% for few days. Majority of the back pain would go. There are certain things which nobody should be doing while having back pain is bending forward, weightlifting, sitting on the ground, and using Indian style toilet. Majority of don't use Indian style toilet these days, so that point is out of question. But these three, no lifting, no bending, and no sitting on the ground, these three are very, very important when you are having acute pain. or any activity that gives you pain should be avoided. So majority of the pain would subside, or you will be at ease within 3 to 4 days time. Sometimes you can apply heat and cold. Science is not clear about. Science says nothing helps. Whether you take heat or cold doesn't matter. Whatever makes you comfortable, you take that. See, why we feel good when we apply heat or cold is, it's heat or cold gives a different sensation or a different stimulation to your brain. So momentarily your brain focuses from the original back pain to this new sensation, so that you feel relieved while you are taking those, heat shake, heat or a cold fermentation. So they don't help in a long run, but momentarily they give relief. You can take over-the-counter medicine like paracetamol if pain is too much, and nothing more than that would be required in acute phase. Now, when you should consult a doctor, one, when you are not able to walk even for few steps in 2 to 3 days time, you have so intense pain that you are almost, that is making you like cry. You start feeling weakness in your leg. You start feeling that your urine or your stool is having some problem. Any of these 4 things are there, then you should consult your doctor immediately. Otherwise, and the chances of having this kind of problems are very rare. Only, you can say 100 cases of back pain, 5 patients will have this kind of symptoms. 95% they don't have. So don't rush to doctor immediately you have pain. Take rest, take it slow for a few days. Most of the time you will be fine. If not, then go and meet a doctor.
Thank you very much. Is there any question?
Vikash has lifted his hand, so I think he must be wanting to ask a question.
Who?
Vikas.
Hi, Dr. Neeraj.
Hello, Vikas. How are you?
Fine, thanks. Thanks for the great presentation. I have a C5, C6 due to a road accident.
Mm-hmm.
I think it was misdiagnosed during the accident. I think it was a tear between, and then now the nerves are compressing slightly. So I tend to get pains and stiff necks a lot. My shoulder freezes. I get a lot of knots around my shoulder blades now and then. I've had, so when I went to the doctor here, they told me to do a surgery, and the way he was saying is going through the front, the throat, to the back of my neck. And he said it was 50-50, and that's when we decided not to do it. And then I went to Nanavati,
Bombay,
and I've done got epidural twice now already to reduce the pain, the inflammation, and all that. I think it was a steroid injection. But the first time it lasted for over a year. Now it's been like 6 months, and again I'm starting to feel the pains and the stiff necks are coming back. And so I wanted to know, what are the pros and cons? How should I be thinking about surgery, or what else can I do?
Well, I think the doctor in Kenya, the advised surgery, we call it ACDF, that is anterior cervical discectomy and fusion. So wherein we make a small cut in front of the neck, we go in, remove the disc, decompress the nerve, put a spacer and fix it with the screw. I guess it's a pretty routine surgery. If you actually need those surgery without any fear, you can go ahead with the surgery. These days, this surgery is very, very, very simple. The critical point would be that to decide whether you really need surgery or not. But looking to your history, the way you narrated it, I think, you have run out of all other options. You might have done physiotherapy, you have already taken epidural twice, and still it is bothering you. Then I think, you would be probably a candidate for surgery. Having said that, I need to see your MRI. But if your doctor has advised the anterior surgery, you can pretty well easily, without any worry, you can go ahead. It's a pretty routine surgery for anybody who is operating it regularly.
Okay, what I'll do is I've got my current MRIs, which I can share to Bina, and she can share it.
Surely.
Thank you. Thank you.
So I guess there are no more questions.
Yeah. I believe if we don't have any question further, I request Ravi Baisap to give a vote of thanks and then we can close.
Sorry, I've just joined in. I do have a question. I'm sorry, power has just gone out, so I kind of glitched a little bit. Can you hear me?
Yeah, yeah.
Yes, Seemaji.
Yes, how are you? Sorry, Neeraj, I've actually missed most of it, but I do have a question. I was just told about it. So I do have a question. I have an L4, L5, S1 spondylolisthesis. L4 is sliding forward and twisting. I developed it about, I think, 8-9 years ago. Subsequent to that, I did a lot of physio. I did a lot of, okay, power's come. I've seen about 8 surgeons before I want to make a decision. The only thing that's really kept me going and helped me straighten out was one was an acupuncture, very deep acupunctures. And then subsequent to that, I've done yoga, which is keeping me going and straight upright because I was really bent forward and sideways. So recently, I had a bit of a spasm and it was really bad, and I was traveling in 2 days. So I went to a pain specialist. She gave me a whole bunch of things. We were in Switzerland. I went to the spine hospital there, and they actually gave me the infusions, 2 infusions, and said, look, I was okay. I didn't really need to do the surgery yet, even though I've seen 8 now, and 6 of them said you need surgery. I've been avoiding the surgical part. Then I went to England. I saw somebody on Harley Street, and he said to me, you don't have to do the fusion, but you can do the spacer. It's a little U-shaped thing, which goes in between and opens up the space. My question is, of course, I'm analyzing everything and trying to figure out what is the best thing. I don't want to be in a fusion situation because I do a lot of yoga. I'm very active. I'm an outgoing person, but that's all curtailed a little bit. I love climbing. I love hiking, but everything has stopped. What is your advice? I mean, there's so many things out there. Maybe the question has already been asked. I'm not sure.
No, I guess, you know, your situation is pretty common. Those who are suffering from spine. At the outset, when I started my talk, I said that, you know, I mean, majority of spine surgery are lifestyle problems. You know, they are not a life and death issue. So, you know, people keep on pulling because, you know, you have an option. Your life is not ending if you don't get operated. The decision of surgery, you know, always I tell my patient, you know, it is patient's disability. If your problem, if your pain is preventing you from living the life which you want to live, the kind of life, you know, you say that you want to hike, you want to do yoga, you are quite an active person. And if your spine problem is preventing you from being what you are, then yes, surgery is an option. You must consider surgery. Surgery gives excellent result. Now fusion and that, you know, U-shaped spacer, you know, we call it an X-top kind of a thing or a Coflex kind of a thing. You know, that a spring kind of a thing is placed between 2
It's just
bones.
a U-shaped thing.
I understand.
You know which
that.
one.
You know, no, and that is world over. You know, if you say in India, in US, you know, that is more or less has been abandoned now. It's the only European countries where, you know, there are no stringent medical device regulation. We are still practicing. So in a spondylolisthesis, you know, I mean, the spacer is a big no. Please don't go for it. If you are having a spondylolisthesis and you are having recurrent attacks of back pain, then you must consider a fusion surgery. With fusion also, you can practically do almost everything. Almost everything. You know, the fusion doesn't hamper you from, you know, living your life normally. Sometimes, you know, if you are probably doing, you know, when 2 or 3 levels fusion, say L4, 5, S1, both has been fused, then your terminal range of movements are somewhat restricted. Otherwise, I have yet to, you know, very recently I operated on a yoga teacher. You know, we did a 3-level fusion, and after 6 months, he is again teaching yoga to his students. So I think, you know, I mean, that's not the bar. We have seen, you know, I mean, with where we have sometimes fused 10 level, 11 levels, 11 level, right from D10 to number 5. So there are around 10 vertebra we have fused, and those patients are doing horse riding. So I guess, you know, I mean, fusion doesn't stop you from, see, the natural tendency of spine is to fuse. The more elder you are, the more you are aging, gradually spine reduces the movement and it starts getting auto fused by natural force. So fusion is not something very anti-physiological. It is a physiological process of aging. We are only doing it in a proper way, slightly earlier, because the abnormal movement in your spine is giving you pain. So if you have disability and your doctors, after reviewing your report, has advised that you might benefit from surgery, you must consider it. Please don't go for those spacers. They are temporary fixes. You will not be happy after that.
Mhm. And what about the progression of weakness above the spine? If you do the L4, L5, there's the fusion. Then I've heard that then you have to
Yeah.
go for the 3 and the 2.
I would want to just quote the science here. This was a major issue 10 years back. We call it an adjacent level disease. Adjacent level, one level above or one level below, the disc starts getting degenerated. Now, with more and more knowledge in spine, as I said, you were absent in the talk. I said that what we know in spine surgery is tip of iceberg, but tip has expanded now, as compared to 10 years before. There is still a lot of submerged portion, but we know much more. So we realize that one reason to have one level above problem is we are not giving proper curvature or a balanced mechanical shape to the spine while doing fusion. So when we started doing this kind of a curvature, the adjacent level degeneration started falling drastically. So in past, it was we were explaining our patient that adjacent level problem can happen in 15% of the patient. Out of those 15%, 50%, that is 7.5% patient would be symptomatic. Out of 7.5%, 3.5% would require surgery. So on and all, out of 100 patients, only 3 patients would require surgery above level. Now with advent of this, when we started understanding that lumbar lordosis mechanical balance of the spine, the 15% has fallen down to 3%. So requiring surgery to this patient is around 1%. So out of 100 patients, 1 to 2 patients only require adjacent level surgery. That is as good as, having an accident and, probably cutting your finger. So I don't think, you should be worried about that part. We know how to prevent that adjacent level to a very great extent. Having said that, we can completely not negate that part. There are still possible chances of having one level above fusion, but it is not that common as it used to 10 years, 15 years back.
Okay, no, that's a good clarification. That's good. So you're saying that if I do a fusion, I can still go bungee jumping?
Yeah, you can.
Bungee jumping?
Yes, but after having a complete documented fusion, that happens after 8 to 9 months. So you can do bungee jumping after 9 months.
When Seemaji, when doctor is telling about that he has done this for yoga teacher and now he's teaching yoga, so I believe that is possible.
No. See, the greatest example, if I want to give, Tiger Woods. Tiger Woods has been operated for five times for spine surgeries, 5 times. And he's still playing professional golf. So if that kind of demand is possible after spine surgery, I think, majority of us don't require that kind of, you can say endurance, this kind of flexibility as a sports person is needing.
I believe Dilip Bhai Sahab before has mentioned that he has started doing for golf and all, and he is having no issues major.
Yeah,
I
exactly.
This is quite good.
So how many on this chat have already had a surgery?
And you did also bungee jumping.
And done some bungee jumping and gone climbing and gone diving.
Correct.
Thank you.
Thank you.
I believe we are approaching 8:30 Kenya time, which is almost 11 o'clock in India.
Yes.
So Neeraj, it must be late evening for you, doc.
Yeah, right.
Thank you very much. I request Ravi Bhai Sahab to please say some few words for vote of thanks, and then we can close. And I believe Beena madam is here, Samani. So if people have some question and queries which they're not able to answer, and they can contact Beena, and then in terms, Dr. Neeraj can respond to
that. Thanks, Nikhilesh. And thanks, Dr. Neeraj. My name is Ravi Kaul. I'm the Executive Director for Health and Environment in Hindu Council.
Hello.
And thanks to Beena, who has pushed us to come to this stage today. Having so many activities, but I think it was a very good topic. So that's why we did it today. But I think we may continue this in some other time also, because this is the festive season in Nairobi. Everybody is busy having their own some things. So I was the CEO of Guru Nanak Hospital. I don't know if you know about it, for almost 12-13 years.
Oh, is it? Wow.
Yeah, I resigned there in 2019. And now recently we have taken a small hospital on a management which we are running. Beena knows about, she came also there. My association with Shelby goes long back, 10-12 years back when I was in Guru Nanak Hospital. I was the one we gave the first opportunity to Shelby to have a medical pre-medical camp in that before you started your office in Parkland. So, and thanks to Niklesh also, who has helped me organizing all this thing. And Kamalji, I think he's already gone. He is the force behind all of us. He pushes us to get these things, get the things done.
Kamal has gone to test his spine, by doing garbas.
Yeah. So I think it's almost 11 o'clock now. And thanks, Dr. Neeraj. I hope we will interact again. If there is any queries, maybe people know whom to contact. It is Beena. Maybe you can, Beena, you can speak about where you are, what you are, so at least people can know.
Okay, we are located on 4th Parklands, Kusi Lane, PJ Medical Center, room D2 and D3. Our clinic is open from 8:30 to 5 o'clock in the evening. From Monday to Saturday, we usually work half day. That's from 9 to 1:30. So I'll share the contact numbers, and then you can call me for an appointment, and you can visit us anytime. Thank you so much.
The contact, so you can share the contact with Seema.
Yes, I can do that.
And thanks to everybody. Thank you.
Thank you all. Thank you. Good night.
Thank you, doctor.
Thank you, Dr.
Thank you, Beena. Thank you,
Thank you,
Tejasvi.
Shivaji.
Very much. Bye.
Bye.
Beena, please share the contacts.
Yes, I will.
Thank you.
So Niklesh ji.
Thank you very much, Bhai Sahab. Let Beena give the number so that I can close the meeting. Once I close, the chat will go 0. So Seema ji will not be able to take that.
Yeah,
thank
you let her type the contact.
Mhm.
I can write in the chat. So we close then, please.
Maybe you can just read it out. Okay, hold on. Let me write that down quickly.
You can take a picture of this, Seema ji.
Yeah, just my phone is far away. Ek minute. Just a second. I got it. Okay, hold on. Just 1 second. I'll take a screenshot of all of you. How about that? Thank you. Okay.
Thanks, Beena. Thank you very much.
Thank you. Thank you so much.
Thank you, Vinay. Thank you. Good night.